Today we are going to talk about acute kidney injury and chronic kidney disease. We are Grace, Anna, Melissa, and Elisa.
What is acute kidney injury? Acute kidney injury or acute renal failure is when both of the kidneys' functions begin to decline. This leads to an increase in serum creatinine levels, decrease or negative urinary output, or possibly all, which can progress into azotemia. When kidney functions begin to fail, this causes a decrease in blood flow in the kidneys, affecting the glomerular perfusion and filtration. Acute kidney injury can typically be reversible if the chief problem is effectively treated.
The etiology of AKI are when the kidneys are unexpected damage. The patient is experiencing heart failure. The tubule is narcosis, which derives from drugs, chemicals, or toxins. Other causes are burns, crush injury, blockage in the ureters, and sepsis. The clinical manifestations of AKI are as follows: edema in legs, ankle, feet, fatigue, shortness of breath, pressure or pain in the chest, seizures, and low levels of urine output.
Abnormal blood tests for AKI will indicate increased creatinine, metabolic acidosis, increased serum urea nitrogen or BUN, and hyperkalemia.
What is chronic kidney disease? It is the continuous, irreparable damage of the kidneys that has occurred over a long duration of time, ranging from mild to severe, and in a few cases, end-stage kidney disease. Chronic kidney disease may develop without any symptoms and is usually identified when the kidney's functions are at minimal. This may also result when GFR levels are greater than 60 mL per minute for 3 months or more and requires continuous monitoring. This may also occur when the nephrons of both kidneys are severely damaged.
The etiology of CKD are as follows: diabetes, hypertension, and high amounts of excretion of proteins. The clinical manifestations of chronic kidney disease are as follows: edema in feet and ankles, itching all over the body, nausea and vomiting, anorexia and loss of appetite, fatigue, muscle cramps, as well as anemia, polyuria, and unexpected weight loss.
Who is at risk for acute kidney injury and chronic kidney disease? Individuals 50 years and older, smokers, diabetics, history of hypertension, family history of kidney disease, children born with underdeveloped kidneys, people who are of Aboriginal, Asian, South Asian, Pacific Island, African Caribbean, and Hispanic descent, particularly medications, toxins, pesticides, or illegal drugs. Examples are heroin and cocaine.
Diagnostic tests used to confirm AKI and CKD include urine tests, blood tests, which includes creatinine and GFR, ultrasound, and biopsy. What is the prognosis of acute kidney injury? If the underlying cause is successfully treated, recovery is usually rapid and complete. After having AKI, there is an increased risk for other health problems such as kidney disease, stroke, heart disease, or having AKI again in the future. The chances for developing kidney disease and kidney failure increase every time AKI occurs. The best way to lower your chances of having kidney damage and to save kidney function are to prevent acute kidney injury or to find and treat it as early as possible. Chronic kidney disease prognosis. In stage 1 and 2, you're expected to have a normal life expectancy, but need treatment to stop further progression. In stage 3, you may not have signs or symptoms of kidney damage, and your life expectancy is 24 years after diagnosis. In stage 4, your life expectancy is 14 to 16 years after diagnosis, and you will require dialysis or transplant, and the right diet and medication will slow down progression of the disease. In stage 5, you're considered to be in end-stage renal failure or disease. Your life expectancy is 13 to 14 years after diagnosis, and you must start dialysis immediately or have life-saving transplant. Thank you for watching our presentation, and stay safe.